Hello everyone, so today I'd just like to talk a little bit about the Ulna Paradox. So your nerves travel from your spinal cord to your brachial plexus, and then forms the ulnar, median, radial nerve, and some other nerves. And usually the higher the lesion, so the more proximal the nearer the lesion is to your spinal cord, the more abnormalities are present. However, in the abnormalities of the ulnar nerve, there's something known as the ulnar paradox, which is where a low ulnar nerve lesion creates a even more prominent clinical finding than a high ulnar nerve lesion. And this refers to the ulnar claw hand. So first you need to understand what is ulnar claw hand, right? So ulnar claw hand is caused by, because your ulnar nerve innervates the lumbricals of your fourth and fifth digits, your ring finger and your little finger, the lumbricals there. So the function of your lumbricals is to flex your MCPs, metacarpophalangeal joints, and also extend your interphalangeal joints, your proximal interphalangeal joints and your distal interphalangeal joints. So that's the function of lumbricals. So when your lumbricals lose their innervation, right, so your lumbricals cannot contract anymore, you can't do this anymore, so you have fixed flexion of your interphalangeal joints. So this is your ulnar claw hand. When you ask them to open their hand, they can't open the last two fingers because of the lack of innervation of the lumbricals. So you can't extend your interphalangeal joints anymore. And then ulnar claw hand is seen in both low ulnar lesion and high ulnar lesion. However, in high ulnar lesion, you see a less extent of the ulnar claw hand. So let's say low lesion ulnar claw hand is like super flex, right? But then higher lesion ulnar claw hand is not so flex. It's like not as flex as in a low lesion. So your ulnar claw hand is less severe if it's a high ulnar nerve lesion. So to understand why, right, you need to, actually the ulnar nerve innervates a lot of muscles in your forearm and also in your intrinsic muscles of your hands. But to understand this ulnar paradox, you only need to know two functions of the ulnar nerve. Two muscles that are innervated by the ulnar nerve. The first one is the medial part of your flexor digitorum profundus, FDP. So what your flexor digitorum profundus does is it flexes all your interphalangeals and your metacarpophalangeal joints. So that's your function of your FDP. So the medial half, which is the last two fingers, supplies the last two fingers. Lateral half supplies your index and middle finger. So ulnar nerve innervates your medial half. And the other muscles I already mentioned is the lumbricals. So you just need to know these two innervations. So to why high ulnar lesions will produce less of an ulnar claw hand, it's because the ulnar nerve also innervates the medial half of the flexor digitorum profundus. And because the flexion of your IP joints is by your flexor digitorum profundus, loss of function of your medial half of FDP causes your flexion to be less. So there's less flexion of the IP joints. So your ulnar claw hand doesn't look as severe. Hope that is understandable. Not sure if I articulated it clearly enough. It's my attempt. Hope it helps. Thanks for watching.